The spread of coronavirus is accelerating.
At the end of 2019, Chinese health officials confirmed they were treating dozens of pneumonia cases with an unknown cause. It was a new coronavirus, SARS-CoV-2. And then
the first case of a new potentially deadly virus has been confirmed in the United States, and it's right in our own backyard.
Patient 0 in Washington state.
There is new concern about a deadly virus.
January 19th was that first case, and that will always be in our memory.
UW-Medicine jumped in to help with a home assessment team.
Lynch says the advantage is they still help the patient without having to tie up entire sections of the hospital.
It's clearly dangerous. It kills people. This is not a cold.
It's a global health emergency.
Unfortunately. On February 29th, the first reported death in Washington state and the U.S. And then
today we learned
everything changed.
3 more people have died.
One of the 3 patients died here last week at Harborview Medical Center.
Tonight, the governor of Washington declaring a state of emergency.
The risk for all of us of becoming infected will be increasing.
Help has arrived, and in a big way. UW-Medicine's virology lab has already tested 200 specimens for COVID-19 and has the capacity to test 1,000 to 1,500 samples a day.
My goal is that everyone who needs a test can get one.
And Seattle and the West Coast are the front lines for this virus.
In fact, they started developing a test as soon as the virus sequence became available in early January.
I really need to call out just the heroic work that our staff has done, and they're all upstairs working right now.
Because with so many samples of the virus in our region, the whole country is looking to their work.
I want to commend the University of Washington for the extraordinary work they're doing, expanding tests to the people impacted in Washington State.
Going through drive-through testing now. The University of Washington Medical Center in North Seattle testing staff, faculty, and trainees.
And now UW-Medicine has opened up a drive-through testing clinic for patients.
It's really for those individuals who do not need a hospital setting, but don't have an alternative in terms of a safe, secure environment.
But this battle against COVID-19 isn't without its own challenges.
And I'm going to turn it over to my colleague, Dr. Santiago Neme.
When it comes down to lab testing, turnaround time is PPE.
Dr. Jeff Baird is the acting chair of laboratory medicine at UW-Medicine in Seattle.
What is your model showing you today?
So our projections through till August 4th are up. We're up to 137,000 deaths that we expect to see.
The uncertainty keeps me up at night, knowing that that's coming, and that's going to be a huge surge.
To hear a mother's, basically the agony in their voice, to hear the story about, about their family member that was a victim to this virus.
I've seen more crying doctors and nurses in the last 2 weeks than I remember in my career because of the stress that this places on them, watching families have to be at a distance and patients being alone.
So as you walk through and you see the hard work being done and people doing everything they need to take care of patients, it's awe-inspiring.
I will say the last few days we've been able to take our first breath. Inside UW Medical Center Northwest, a look at how far they have come in a short period of time. The virus may have hit them hard at first, but now these healthcare workers are leading the way.
Number one priority for us is maintaining the excellent patient care that we do.
Vemos a todo tipo de pacientes, con seguros y sin seguros, con papeles, sin papeles. Nosotros vemos a todo el mundo.
And with the testing, we didn't see any further cases in this facility. So I think it can work. And we really want to get the message out there that it's not hopeless in congregate settings for older adults.
At the University of Washington, it's his institute's coronavirus modeling that the White House decided as it develops policy to confront the pandemic.
And Deborah, your lab in Seattle has been looking for a vaccine for the coronavirus.
Overall, vaccines really are probably the one medical intervention of all the other types that are being tested that has the greatest hope for eventually slapping down this pandemic.
We have a singular focus on this vaccine project in a way that we've never had before.
We're trying to representatively test individuals in our community. And you can think about it like sonar pings, pinging to see what lurks beneath.
It's really a game changer for the field to know, first of all, that having an antiviral drug that works.
So the antibody recognizes the apex of the spike glycoprotein.
And a groundbreaking discovery out of UW Medicine. Researchers say an antibody found in a person who recovered from SARS can neutralize other coronaviruses, including the one that causes COVID-19.
And in this crisis, we saw our communities strengthen and fight this as one.
Hey, what up to the UW Medical Center? This is Lizzo. Shout out to all of y'all for being so brave and working so hard and making sure that we're safe and healthy and healing people. That is incredible. You guys are heroes.
We started making our own hand sanitizer.
For him to get better really just gave us some hope that everything we were working so hard for was not for nothing.
I just remember that FaceTime, I was still out of it, and I just remember all of a sudden I heard them over the phone. It was wonderful, it was wonderful.
On the 22nd, the tests came back negative. The coronavirus, like all bullies, retreated in the face of something tougher than itself. In this case, a 90-year-old Texan whose kids describe her as a bat out of hell.
And I'm still fighting, and I'm still pushing, because I still have a lot to live for.
If you could communicate with that damn coronavirus, what would you tell it?
Goodbye.